Hi, everyone. I'm Ben Gonzalez, and this is TDI. Today, we're going to be talking about mental health, behavioral health issues in the age of COVID-19. And joining us today is Colleen Horton, the Director of Policy at the Hogg Foundation for Mental Health at the University of Texas. Welcome, Colleen. How are you doing today?
I'm doing well. Thank you. And thank you for taking on this topic. It's an important one.
Yeah, it's definitely one we want to talk about. There's been so much discussions of late about, the physical aspects of COVID-19 and how it affects us and people around us. But now we're starting to see more concerns about people's mental well-being as well. What is the concern about the issues related to the pandemic? Is it just the isolation?
Well, I'm not a clinician, but I think it's actually, accurate to say that the pandemic is definitely impacting people's mental health, and it's impacting people differently. Mm-hmm. Some people actually thrive with working at home and the isolation, but many more are struggling, not just with the isolation, but with financial burdens, with trying to balance family and childcare and work all at once. And also not knowing what's to come. There's a lot of unknowns in our lives right now, and many people struggle when they can't plan or when they can't predict the future. So I think it's really important to recognize that both mental health and substance use challenges could very much be a product of this crisis.
Right, a secondary kind of pandemic. Right. Are we seeing any evidence that more people are seeking help?
Well, there's not a lot of data out there yet, but we do know that thousands of people have called the statewide mental health support line. And this is a line that was set up by the Health and Human Service Commission in March, very early on in the crisis, which was an incredible thing for them to do. Mm-hmm. And we know that, as I said, thousands of people are seeking help through that line. Many services are being delivered through telehealth, both through computer and phone right now. So we're learning a lot about how to better deliver mental health services to people who need.
At the agency, at TDI, we've also been kind of reminding folks about the telehealth being there. You could have an office visit that you don't have to leave your house. So that's kind of nice for some people. Do you think more people are taking advantage of the technology?
Oh, yes. We've seen an actual explosion in telemental health services in the last month. And part of it is because of the pandemic. Both the federal payers and state payers have relaxed the regulations around using computers and telephone lines to provide these services. And a lot of people really appreciate the ability to do it via telehealth because it addresses barriers that were actually there even before the pandemic, such as transportation and childcare. So while telehealth isn't the ideal for everyone, some people prefer the in-person services. I think it's really opening doors for us to really take a look at what systemic changes we need to make access to mental health services easier for folks.
We've seen the same kind of issues just with a physical doctor visit. Some people really don't like talking to their doctor through their phone like we're doing today. But you mentioned barriers to access. Are there some people that are just hesitant to look for help?
Yes, I think stigma continues to be a problem with mental health. It continues to be a barrier. And even though we're making progress, we really need to keep talking about it. Some of the stigma comes from cultural and societal norms. Some are very individualized, but we need to keep working on trying to normalize mental health care and make it as easy for people to access and talk about as their physical health care. Right.
And that's what we try to do at the department as well. We've been trying to remind people that, look at your health insurance plan. And if it may cover some mental health treatment, and people sometimes don't think about their insurance being something that can help them. Does your group find any misconceptions about how to pay for insurance or how to access it?
Yes, I think people who have never sought out mental health services often don't realize that it's something that may be and should be covered by their insurance. So it's really important to focus education efforts on helping people to know what questions to ask, because often you don't know what you don't know. Mental health parity is still a problem in our state, and parity refers to the requirement that mental health be treated just like physical health care, that you have the same copays and the same service limits, that kind of thing. And we're still seeing a lot of data where we aren't really meeting the mark nationwide, actually, on mental health parity. So if people know the questions to ask and are more informed, then they can certainly be better prepared to request the services that they have a right to receive.
Okay, so parity means that the things should be equal then.
Right.
Mental health and physical health. If you have 10 visits for one, you should have 10 visits for the other. Yeah, we see issues with that as well, and we try to let people know that their policy, if it covers mental health services,
Right.
it should be covered at the same way that the physical health services are covered.
Right. And if people know that, they're better able to push and ask the right questions to access the services.
Great. Thanks for talking to us, Colleen. Where can people go if they need help? They've realized they need help, but they're not sure how to get started.
Well, there's several places. I would suggest that folks first start with their primary care provider if they have one. Ask their physician, what might be available in their area. And sometimes people need referrals for mental health services. There's also, as I mentioned earlier, the statewide mental health line that was set up as a result of the COVID-19 crisis. And people can go on, call that number and get direct access to a mental health professional who they can talk with. And the number is 833-986-1919. Additionally, we have a system of mental health services in Texas through what we call our local mental health authorities. There's 39 of them around the state, and you can go on the Health and Human Services Commission website and search for local mental health authority, and it will give you a way to identify the authority that is closest to you. And these authorities have clinics throughout their service area, and they provide screening, evaluation, mental health assessments, substance use assessments, and services. So it's a good place to go and look if you're having difficulty locating services in your area.
Is that for people with insurance or for those without?
Actually, most of them will take insurance. They will bill insurance, but they also provide services to people on Medicaid and people without insurance. So it's best to contact the one closest to you and find out exactly how they operate. People can also call 211, the statewide information and referral line, and they can provide folks with information on services that may be available in their area.
Excellent. Well, thank you so much for your time. I hope we helped some folks today. And we have information about insurance on our website. It's tdi.texas.gov. And if you have a question you'd like to ask about insurance, you can call our helpline. There's people standing by there to answer your insurance questions. That number is 1-800-252-3439. For Colleen Horton, I'm Ben Gonzalez. This is TDI.